Hot flushes and night sweats are the most commonly recognised symptom of the menopause. Approximately 55% of women experience hot flushes up to 2 years before their menopause. The prevalence is thought to be highest in the first year after the final menstrual period, when they occur in 60 to 80% of women, but possibly up to 93% of women. We know that they vary in frequency and intensity, but in studies they are reported as being severe in 29% of women. Hot flushes are usually present for less than 5 years, but the median duration is 7 years. 50% of women are still experiencing hot flushes 4 years after their last period, and 10% of women still experience hot flushes 12 years after their last period. So what is a hot flush, also known as flashes? Hot flushes are defined as transient periods of intense heat in the upper body, arms and face, which are often followed by flushing of the skin. They can involve any part of the body. It typically lasts 1 to 5 minutes. It may or may not be associated with profuse sweating and redness or flushing, and many are followed by chills. While the skin temperature raises several degrees Celsius, the core body temperature appears to fall. Women having hot flushes may also experience palpitations and a sense of anxiety. For some women, these can occur every hour, but for other women, they happen much less frequently, such as once a week or once a fortnight. Why do hot flushes occur? The pathophysiology is not fully understood, but it is thought very likely that the thermoregulation zone in the brain changes in response to the low estrogen levels. The hypothalamus becomes narrowed so that vasodilatation and sweating are triggered at a lower temperature. Whilst low estrogen is key, not all women with low estrogen develop hot flushes, and there is a huge variation and severity in duration. We also know that whilst estrogen levels stay low during the menopause, most women will stop having hot flushes after 5 years, so that cannot be the full explanation. There are likely to be many neurochemicals involved with the mechanism causing hot flushes. We also know that flushes can be aggravated by stress and anxiety, diet, lifestyle and medications. Hot flushes are a very common and often debilitating symptom affecting the quality of life during the perimenopause and menopause. Thankfully, there are effective treatment options, and we would be very happy to discuss these with you at Medical Prime. What's the fuss all about? Hot flushes in themselves are not dangerous, but they can have a significant detrimental effect on the quality of life. They can cause considerable distress, particularly if frequent. Daytime episodes can be socially embarrassing and professionally challenging. Heavy sweating and hot flushes have been shown to significantly affect sleep quality and increase the risk of frequent waking at night. Sleep disturbance contributes to fatigue and irritability. Anxiety and depression scores correlate with sleep quality, so the poorer the quality of sleep, the more this is likely to impact on emotional well-being. A correlation has also been found between the severity of hot flushes and the risk of cardiovascular disease. Women experiencing more severe hot flushes seem to be at a higher risk of heart disease. This could be useful in helping us to identify women at this higher risk and to make sure they get preventative care and monitoring. How can hot flushes be managed? Lifestyle is very important. For many, weight loss can be beneficial. Reducing alcohol and caffeine can make a significant difference to the frequency and severity of hot flushes, as can changes in diet, such as the exclusion of spicy and sugary foods. Regular exercise can also be extremely beneficial. Cognitive behavioural therapy shows good evidence of reducing hot flushes. If hot flushes are still problematic after these lifestyle changes, hormone replacement therapy can be used as a very effective treatment. Estrogen replacement works extremely well to treat hot flushes. For those who cannot take estrogen or do not want to, there are other options as well, such as selective serotonin reuptake inhibitors, which are well-known antidepressants, also known as the SSRIs. There are also other medications, including clonidine, oxybutynin, gabapentin and pregabalin. There's a new non-hormonal medication that is the first non-hormonal drug to be licensed for menopausal hot flushes. This will be another good option for those looking for an alternative to estrogen replacement. Hot flushes are a very common and often debilitating symptom affecting quality of life during the perimenopause and menopause. Thankfully, there are effective treatment options, and we would be very happy to discuss these with you at Medical Prime.